Your orthodontist is recommending phase 1 orthodontics. What does that mean? Phase 1 orthodontic treatment is when your son or daughter has a mixture of adult or baby teeth. We talked earlier about why we'd make those recommendations to have this treatment. I wanted to pull up an example of where my son, who's 8 years old, I made the recommendation that we needed to jump in at this age and fix his teeth. So this is Enzo here, and looking at his bite, I'm going to pull up his scan that we have. We'll recognize that these are the top teeth, here are the bottom teeth, here are the bite images. And although the teeth don't look straight, and yes, we do want to improve that for him, my main concern for Enzo was the fact that his permanent front teeth were colliding with each other too excessively. What that causes is those adult teeth are going to be wearing down faster than they should, so that if we left this when he's older, those adult teeth would be shorter. That wouldn't be a good thing. So we recommended some appliances so that we can improve the alignment of the teeth, but also improve the function and health of these front adult teeth. So now let's talk about an example of where we didn't recommend phase 1 treatment, because not all children need phase 1 orthodontics. This is my daughter. She is 10.5 years old, and she got all of her permanent teeth in quite young. So she's got all the adult teeth in place now. She didn't need any orthodontics up until now. And I'm going to pull up her scan here, and we're going to look at the different views, the top teeth being here, bottom teeth being here, and then the bite images. If you look at the alignment of her teeth, they're not that bad. They're not that crowded. Things are fairly aligned, but looking down at the bite, there's some bite issues going on. This is a good example of a case that you don't need to do early treatment. We're just going to do this in one single phase. This is also a great example of a patient that should be seen by a specialist, someone, again, who is specialized and expert in growth and development, because I can tell by looking at her bite images, she's got a lower jaw that needs to grow forward, and we're going to be using some elastics, some rubber bands with her appliances to straighten her teeth out and improve the way that the bite is aligned. Going back to my son, he needed phase 1. He'll need a second phase of treatment when all of his adult teeth are in place, probably closer to the age of 12 or 13. But as you can see with my daughter, she didn't have phase 1, and we're going to be doing one single phase of orthodontics for her, and we're going to be using aligners. So looking at the two patients here, my son and daughter, we can see that Enzo had the recommendation of early phase treatment. Doesn't hurt to bring your child in at the age of 7 so that we can do that assessment. It's not always needed. As you saw in my daughter's case, she has all her permanent teeth and she just needs one single phase of treatment. It really depends on the problems, but you should always get assessed to see if we're going to make those recommendations. If you want to learn more about straightening your teeth, check out this next video.